Welcome to Pennsylvania in Focus. I'm Kristen Smith. The Rural Healthcare Services Outreach Program, a federally funded initiative through the Health Resources and Services Administration, is intended to alleviate some of the burden faced in Pennsylvania's more remote communities, and the program is preparing a new round of financial support for the coming year. Joining me today is the Center Square's Pennsylvania reporter, Christina Lingeau. Christina, what is healthcare currently like in rural Pennsylvania?
Things are pretty strained across the rural regions in the state. Right now, there have been a lot of issues with expansion of these bigger hospitals, and there have been a lot of issues where bigger hospitals have expanded and then local primary care doctors and smaller offices have closed their doors, partially getting absorbed into those bigger hospital systems and partially due to really extreme expenses like liability insurance or malpractice insurance. So as a result, for a lot of people who are already pretty remote, their healthcare is getting farther and farther away. We're seeing big maternity deserts crop up where there are wide swaths of area where women would have to drive 45 minutes to an hour to get to a hospital that has labor and delivery. We'll also see a lot of people who will forego routine screening and stuff like that because they don't want to drive out to these bigger centers, or where there's been a bit of a breakdown of trust because those more familiar local doctors aren't there anymore. Rather, it's a bigger network and you kind of get who you get. So there's a lot of issues there, and there's a lot of concern around more hospitals having to either shut down certain departments or have fewer beds available. And all of that is in the face of a lot of really pressing health crises that are really pronounced in the rural area. Specifically, you see a lot of issues with substance abuse, issues with diseases of despair that kind of correlate to some of the regional economic decline. And then you see higher rates of obesity and related diseases like diabetes and heart disease. So they're working with a lot. They have a lot to contend with.
So how can these grants help with this situation?
So these grants offer between $200,000 and $300,000 annually to participating programs to deal with a specific issue. So a lot of the programs that have received grants in the past deal with preventative care and focus on a very specific issue or a very specific demographic that they want to work with. For instance, one of the programs that has been a recipient from the 2021 to current funding round is a project called Honey, which focuses on nutrition and exercise in the youth population in Western Pennsylvania. And so their goal is to kind of lower the BMI of participating overweight children and ultimately reduce ER visits and reduce incidence of weight-related diseases, again, like diabetes and even heart disease, which they're seeing at younger ages.
Christina, thanks for joining us today. Listeners can keep up with this story and more at thecentersquare.com.